One of the things you said there that I know patients, at least the ones we see here at the clinic and ones I speak to all the time, is that feeling that there are so many options, and that is overwhelm because you're not dealing with a well-tuned athlete as a patient here that is used to doing so many different exercises and so many different instructions and taking them well and waking up at 6 a.m. and working out all day. You're dealing with people that have been told, take this medicine, you'll get better, and that's it. And that's all you needed to do, the simplicity of that. And at the same time that it's actually making you worse. So it's simple, but it made you worse. So you're in a downward spiral. You're used to very simple. And here, like you said, there are so many options, and it becomes overwhelming, I know, for patients. Do I go to the integrated one? Do I go to the chiropractor? Do I do this? Do I do colonics? How do I eat? I heard ketotarian go. I heard this. And then it becomes too much for the brain. It's actually in a stressful state. It's the paradox of choice. A book I have somewhere right in back of me is the paradox of choice. Too many choices are not a good thing. How do you deal with that in a patient that is coming to you with complex conditions often? As you said, it's not just sometimes an injury. It's psycho-emotional things. It's things that happen in their past. It's all sorts of toxins and nutrition, deficiencies. How do you break it down into the simplest terms? I mean, we have our ways. I want to hear do you ease patients in, or do you kind of find the highest priority for something? What is it that you take this complex thing in their mind of, oh my God, this is overwhelming, and make it simple for them?
That's a good question. So most people that come in the office, they're hurting somewhere.
Yeah.
Headaches, jaw issues, back, shoulder. I hurt my ankle, doc. I hurt my knee, right? So now you come in and they come in and I teach them what's happening and how they might be pre-stressing their body by sitting incorrectly, sitting with one leg under the other one. Maybe they're sleeping on their side stomach. Maybe they have a bad chair. I get a lot of people who, they drive a lot. So the foot just flares to the right, and on this accelerator pedal, it tightens up the iliotibial band, the knee and the heel. And I tell them to get a pillow and kind of straighten it out. But how do I get to that question? They come in discomfort and you help them with that discomfort. Now their mind kind of opens up to saying, okay, doc, what else can you teach me? So instead of coming in and they're very limited, they come out limitless because now they come out wondering, okay, geez, oh, wow, I didn't know that. Yeah, I need help with weight loss. What else can you teach me with my flexibility? What else can you teach me here? And I don't have to dominate everything. I'll tell people, we have a place, I don't know if you have it out there, we have what's called the stretch lab, where people can go to a place and they can just get stretched. So I said, hey, you seem really tight. You need some help with the stretching. We have someone here. If it's inconvenient for you, let me send you somewhere where someone can actually get you on a flexibility program, because everything is so stiff as you age, you can't move. And that's causing a lot of inflammation, backups. Your body can't recover and repair. And there's consequences to that. So I kind of send them to places wherever they need to go, because I know it comes back to me. It's not like I have to control everything. I use other people in my life that help. I look at like geese. Geese fly in formation for a reason. There's 40% less energy on their wings. I want a team of people in my life to make my life easier. I want to know about the stretch lab or integrative medicine or acupuncture. When people ask me these questions, I want to be that hub in the wheel to send them to all the spokes. And if I'm efficient that way, then they trust me to handle them. They send their friends in. And so I'm kind of like that place to go to send them to these other spokes so they can find that health picture, and it has more clarity and more focus. And now they see they're on the outside looking in instead of the inside looking out. So break the pain cycle, because remember, they're in a bad mood with physical pain. Help them out of that. They go, oh, wow, my knee's better. Okay, doc, what can I do now? Well, let's show you this. These are the exercises you need to do. And we could kind of get them in a better pattern to find out where they need to go. Now they see a plan. And as a result of the plan, they see results. They see light at the end of the tunnel, and they stick with it. And so I would argue that doctors aren't good with teaching patients. They're terrible teachers. They're terrible coaches. And as a result of terrible coaches, the way it was before was, since they had the degrees and they were doctors, you were supposed to listen to the doctor. Well, now it's like, doctor, if you're not doing the job, sorry, buddy, I'm leaving. This is not working for me. That's happening way quicker now than it did in the older generation, like I mentioned. And so if the doctors don't change that system, they're going to start losing a lot of those patients. And that's when they're going to feel the pain of the system, because it's kind of weird. In the 80s, I wasn't a real doctor, but now it's kind of like you're going to the top of the food chain. We see like 150 patients a day. So these people are coming in. I'm ready to go every day. I train for I want to be the best I could be. I want to be one of the docs when people come see me, they're getting something out. It's worth the service. It's worth paying for. In order to be a 5-star service provider, you got to be good at what you do, and you have to know have a lot of knowledge to share with people. So if you could offer that, then people are saying, wow, this is great. Go here. This is the place. I finally found a place. And that's how you build that referral system. And, like I said, you just learn what works for people. I think the system is so used to having fish jump in the boat, they're calling themselves fishermen. I'm used to hunting and fishing in the woods and getting really good at the woods and finding out, what the nature is like out there. And you get really good at it because your body adapts. I call the body an adaptive waste management treatment plant. It adapts to stresses, it takes in nutrients and eliminates toxins. So it's built to adapt. It's built to make calluses. It's built to send bone where there's stresses. If you lose a kidney, the other kidney gets bigger. You lose your eyesight, the other senses are more acute. You pump iron, your muscles get bigger. You stress the heart, it gets stronger. So your body is built to adapt. Imagine if you took care of the body and made it better at adapting, you would just have a healthier inside. You have a healthier inside, you could better handle stresses from the outside.